In myeloma, we have a situation where the patient has a tumor cell which produces many copies, and these tumor cells produce a protein, and because all of these tumor cells are identical, more or less, the protein is identical. And this is in contrast to the normal situation where you have many plasma cells of different genetic background which produce proteins which are different. So in myeloma, these tumor cells, these clonal tumor cells, produce a clonal protein which you can measure, which is usually highly increased, and you can measure also with the Hevylite chain test now the relationship between the clonal protein and the polyclonal non-malignant proteins which are produced by the non-malignant plasma cells. The ratio between the monoclonal protein and the normal non-involved protein of the same isotype is important because it reflects the ratio between the size of the clone, the malignant clone, and the size of the normal plasma cells which are left. The more aggressive the disease, the more suppression you see in the normal plasma cells. So it's very important to have this assay because it enables us to assess small amounts of protein, small amounts of paraprotein, which was impossible until now because we could not distinguish when you have very small amounts of protein. You cannot distinguish when you use SPEP between normal and abnormal protein, immunoglobulins, and with the Hevylite chain test available, you can easily distinguish both. And when you use this test and when you look at very small amounts of monoclonal proteins, you find out that with conventional techniques, you sometimes already believe that the patient is in complete remission, but when using the Hevylite chain test, you find out that there's still monoclonal protein. And this works in the other direction as well. When the patient develops progressive disease, and we use the standard techniques, when you use these techniques, it may take much longer to figure out that there is progressive disease. The Hevylite chain test captures or helps you to capture progressive disease in some cases earlier than the conventional technology which is available. For instance, you may have a patient who is immunofixation negative, but he has already signs of progressive disease which you detect, which you find out when you use the Hevylite chain test. So with the normal machinery, you still consider the patient being in complete remission, but adding the light chain test to your test armamentarium, you find out that the patient is already moving into a progressive disease. It's an easier test. You can do it whenever you want. You do it using a serum sample. And what we have shown is that when you do the test at baseline before start of therapy, and when you look at the relationship between the clonal M component and the non-clonal isotype proteins, you find a strong correlation with outcome. It increases our diagnostic sensitivity. So we'll have a better feel about the completeness of remission, and we can detect progressive disease earlier when we use this test sequentially. In addition, this test enables you to measure the non-involved immunoglobulin of the same isotype, which is also very important, which we couldn't do before. So we can study these patients, and what we have seen from our preliminary data is that the suppression of the non-involved isotype is of high prognostic significance as well. We have just decided in our institution to use it as a routine test. So we'll do it at baseline in all patients because the Hevylite chain ratio, as mentioned, is of prognostic importance. And then we will decide when the patient is not in a trial, we'll use the test when the patient either has a difficult to measure monoclonal protein, or when the patient enters remission, complete remission, in order to ensure that our test really captures what is the real situation in the patient and to increase our diagnostic sensitivity.